COPD, chronic obstructive pulmonary disease, is a disease that affects your lung. These are the lungs. We have pair of lungs that are directly connected to the external environment, where we are exposed to pollution, smoke, gases, cigarette smoke, and many other particles that enter the lungs and kind of damage them. So these are the normal lungs. They are very spongy and pink, and these are COPD lungs. You can make out they're quite different. So what really happens is COPD is a disease where the lung tubes are getting narrowed and the alveoli, the breathing exchange units, are getting damaged. This is when a person will experience a lot of breathlessness, a lot of cough, and also produces a lot of sputum. This disease is so dangerous, it is the second most cause of death in our country. After heart diseases, COPD patients die the most. But do you know this? It's a very common disease, but the disease that has no awareness at all. So COPD is seen in both men and women, especially if they're more than 40 years and are exposed to all these triggers or risk factors. Right from childhood, a person can be exposed to these triggers and risk factors, especially air pollution in our country is very high. That is leading to COPD. The highest number of cases in the world is seen in our country. So how do you really diagnose this? It is by doing pulmonary function tests called as spirometry, impulse oscillometry, and we also use some CT scans or chest x-rays to diagnose this disease. Treatment is holistic. It is not just medicines. We make sure the patient gets medicines, physiotherapy, good protein diet because they lose a lot of muscle, and also they are supposed to get vaccinations done to prevent diseases like pneumonias, which on top of COPD can put the person at risk of death as well. So COPD is a disease that needs to be addressed properly. Consult a pulmonologist if you are facing any of these symptoms, especially if you're a smoker. Take care.